6 days of good afternoon, everybody. We are starting with our third level online workshop, and this will be theoretical classes. Daily, there would be 4 classes, and we would be covering over 6 days. And we would request you to please attend them very wholeheartedly, keeping your videos on and all the instructions which have been posted by Deepthi in the WhatsApp group. Kindly label your phones or laptops properly for the sake of attendance and taking photos, as well as be attentive, and let's make it a very interactive program. Now I have the pleasure to introduce our ex-president, Dr. Mangla Wani. And what is very beautiful, and I'm very glad that I have the opportunity to introduce her. She is the obstetrician and a lead obstetrician who helped to set up this IBCLC culture in India. Ma'am is an obstetrician, like gynecologist, and the first lactation consultant, I can say very proudly, of India. And she is the director of the Hirkani movement and of gynecology and breastfeeding medicine clinic she is running in Pune. She's been our past president, and she has number of posts to her credit, and at the moment she is the clinical secretary POGS, that is the Pune Obstetrics and Gynecology Society. She is the course director of our IBCLC lactation training during the year 2020 to 21, and she's been the national trainer for IYCF. She has number of awards to her credit, including the Young Scientist Award in 1996 in Japan. She also was the Best Debutante Award in 2010 in the POGS, and the Dhanvantri Award, and from the Maharashtra BPNI, she was awarded with the NB Kumta Award. More than that, she is an excellent human being, very soft spoken, very kind, and always helps each and every one. And she's an excellent teacher. Over to you, Mangla, for this topic of today on antenatal preparation for breastfeeding.
Thank you, Sushma, so much for your kind words. I'm really humbled,
Yeah. Just one small announcement that I forgot to make, that at the end of these 6 days of classes, we are going to have an exam after 2 to 3 weeks of finishing level 3, which would be over the time told to you all how we will be conducting it. I guess, Manglaji, you can start.
So, hello, good afternoon, everybody. How is everybody? We are meeting after a long time. We met during the part 1 course. Do you all remember us? Me, Sushma ji, we were there.
Ma'am.
Yes, ma'am.
Yes.
Good afternoon, ma'am.
Good afternoon, ma'am.
Yes, ma'am. Yes,
So you can just
Yes, ma'am. Good
unmute for
afternoon.
a
Good afternoon, ma'am.
seconds and talks, and then again mute yourself. Yeah. So how your preparation going on about the exam? Tell me, have you started preparation or not? I'm going to talk about antenatal preparation, but let's talk about your IBCLC preparation first. Nobody's talking?
Yes, ma'am, started.
What started?
Yes, ma'am, we have started.
What?
Yes, ma'am. Trying to start with the reading.
Started.
So you got some books?
Yes.
And you made some groups?
Yes.
You started solving your
The groups
MCQs?
from the hands-on.
And
We are
MCQs?
coordinating there.
Because exam is a technique and it is mainly the MCQs. So even if you have the knowledge, but if you don't understand the mainstream or you don't understand what they mean, sometimes we know and we rushly answer something. So practice the MCQs. Very, very important. Yeah. So what are you, now you have a hands-on skills also. So are you putting that into practice? Are you trying on your patients?
Yes,
Latching
ma'am. Sure.
system रहा
Yes,
है.
ma'am.
Have you
Yes,
We are
tried
doing
ma'am.
that.
latching? Baby was refusing to latch, and anybody who has helped that baby to latch?
Yes,
Yes.
ma'am. I've tried the drip drop method in my patient because the baby was completely on bottle feed. The mother was exclusively pumping, but the baby was bottle feed. And after I introduced the drip drop method, it's been, I think, 15 days now. The baby is latching well.
That's good. Very good.
Thank
Excellent.
you.
Anybody else?
In fact, in a practice, it has helped me. In a way, I have become more confident in talking. And, the hands-on training has been really helpful. Being a pediatrician for so many years. But then, the way with the conviction I'm speaking to the patient, it has really helped me a lot.
Really helps. They actually need very little help. They don't need much help. But building their confidence is very important. So the way you talk and the way you are adapting the counseling skills, that will help them up, and listening skills, all those things. So continuously keep putting into practice. Just putting practice also, you will get lot of knowledge. You will learn yourself more and more, so that is very, very important. Okay, so we will continue on talking. Actually, this is my old biodata. I wanted to add something, but I'm going to give another lecture in 3-4 days time. I will add into that. Okay, so let us talk about the antenatal preparation for breastfeeding. So when we talk about breastfeeding, the baby is born and then the breastfeeding starts, isn't it? So why antenatal preparation? The baby is not there. So what do you think? Why we have to prepare during pregnancy? And I want everybody to talk, not the same person talking. And let's have everybody equal chance. I can't see everybody on the screen, but I will be noticing Sushma madam is there, Mansi is there. We all will be noticing how many people are active. And now only we can predict the result, who is going to pass the IBCLC. So the more active you are, when you talk yourself, then okay, what things you don't know. No, don't be shy or anything. We are all in the same boat. I still don't know many things. Even simple things myself, I can be wrong. Yeah. So talk. If you have any queries, you should keep talking. If you want something else, some more topic to discuss, you should come forward. Because it is all we are preparing for the exam. So what is the need for antenatal preparation?
The mother should know about the latch, how to latch the baby, and what all things she should expect in the fourth trimester, especially in the coming first week. So it
Correct.
won't be overwhelming for her.
Very good, Rupal. Anybody else?
Ma'am, like if they are aware key importance, what is the importance of the breastfeeding, and there will be some support group to help her when she delivers. Because many moms sometimes comes, they don't know, like there is somebody will come and teach them about all these things. So they keep trying. Sometimes they buy some things, some they buy some pump before the delivery only, or they are ready for the formula feeding. There are a lot of they spend on a lot of things, and also there will be a lot they gather some inappropriate information from the Google or their friends. So they knew ki, they predict some issues also. So maybe if they know ki there is somebody who can discuss about the breastfeeding, I think it will be really a great information for her, and it is a good priming for her, ma'am.
Correct. Very good. That I like that word, the priming, because, the breastfeeding is natural. Okay. The baby is born. So what everybody thinks, the mother herself, the parents, the husband, that she puts just the baby to the breast and the baby starts sucking. And that is the end of the story. It happens every 2 to 3 hourly. Baby is hungry. They put the baby to the breast. Baby takes breastfeeding and that's it. लेकिन ऐसा होता है क्या? ऐसा तो बिल्कुल नहीं होता है. So we have to make her aware कि what things can happen. First of all, you know, she has to know what the breastfeeding is, why it is so important, you know. So even if the breastfeeding is natural, still, to me, I feel less than 10% of the mothers actually the breastfeeding will go smoothly without any supervision. The rest of the mothers will have a lot of hiccups, and more than 50% of those mothers in few weeks will actually stop breastfeeding, and the babies succumb to the formula and the bottle. So that is what happens. So antenatal preparation can be defined as imparting the information on the importance and management of breastfeeding, beside providing support, encouragement, and reassurance to the pregnant women and their families. It is important, we should not say only to the mother, we have to involve the families all the time. Particularly, the seniors who are going to be there and who are going to be guiding her. So we have to make sure that their knowledge is also appropriate. The prenatal interventions delivered alone or in combination with intrapartum and postpartum components, where they combine both the education, the support, and of course the family in effective in increasing the success of the breastfeeding. So even when we say the BFHI, there are 10 steps. Do you remember? We have spoken briefly in the level 1. We are going to now in the future going to speak in detail about the BFHI. So BFHI is what? What is BFHI?
Baby friendly hospital initiative.
Correct. So there are the 10 steps that UNICEF and WHO has, mentioned. So these 10 steps, if the maternity unit follows, the success of breastfeeding increases. So this is the step 3, that discuss the importance and management of breastfeeding with pregnant women and their families. So this is very important step even in the 10 steps that is mentioned. So family support, it has been found that giving knowledge to the mother alone does not have much impact attitude, but the family members and the peers towards breastfeeding has a greater influence on the woman's breastfeeding success. So interaction with the family members and find out about their opinions, about their beliefs, their tradition, taboos, myths. It really helps, to increase the success of the breastfeeding. Another thing is, we have to give the information, the education, and building of the confidence of the mother. So antenatal education actually empowers women about the breastfeeding decision. So, and another important thing is, we have to give the information which is accurate, which is factual, research oriented, evidence based, without conflict of interest. That I have attended somebody's antenatal classes and they were actually talking about the formula, even how to make the formula. So that is conflict of interest. So we shouldn't be doing that. And then we have to talk about the importance of the breastfeeding, about the risk of the replacement feeding. That also we have to mention. And not to be biased, just what I feel. It is what scientific based. And no marketing information. No formula companies are supposed to conduct the antenatal class. Okay? Very, very important. So this builds her confidence, ability to exclusive breastfeeding or finding replacement feeding options if medically indicated. So there is an antenatal class and the postnatal class on the breastfeeding. And there are few differences. Like antenatal class is formalized, it is well defined, and it is descriptive. But the postnatal is usually aims to solve the problem. Because now the baby is in the mother's hand. So what problem she has, and more practical oriented. And pregnant women has a lot of time. So you can give the time and give her information. The mothers may not have much time. They may be anxious. So too much information is not useful in the postnatal. So we have to have a few certain information and more practical information, practical oriented information to postnatal women. And the demonstration we do in antenatal, but postnatal there is a baby, so it is the practical help. Okay. So WHO in 2008, actually I cannot see for some reason my screen complete, so I may be skipping few words at the end, but that's okay. And I'm sure you understand that. So it describes no specific period when antenatal class should be conducted. So actually it is mentioned ki as early as possible, whenever you have an opportunity, you can tell her about the breastfeeding. You can conduct the breastfeeding class for her. So first or second trimester, you know, but ideally that is too early, because first trimester when she's 3 months, or even second trimester early 4 months, she may not remember by the time baby is born. So what you can do is, like in the clinic, you can just sensitize her every time she comes to the clinic, give her some information, because when we have a busy OPDs, we can't just talk about breastfeeding. There are more important things in the clinic, but we can sensitize her. But ideal antenatal class beginning of the third trimester. So when she's end of the 7 months, around that. There is also risk, in case she has a preterm delivery, then she may miss the class. So that is this thing. But generally, yes, preterm delivery is only 5 to 6%. So most of the women should able to attend the antenatal class. Now, ACOG, that is American OBGYN Society. So what they have advised, they say that obstetricians and gynecologists, they have an important role in the breastfeeding. So they should advise, encourage, and support patients for breastfeeding during pre-pregnancy, prenatal, and postnatal visit. I'm a gynecologist. There are few gynecologists in the group also. So gynecologist also has an important role. So they should, sensitize the woman by giving the antenatal class. So this is one of the good hospital practices surrounding the childbirth. So early third trimester, so we discuss that if conducted earlier, she may forget. If late, she may able to attain, or premature delivery, the risk. Now, how do we conduct the antenatal class? Now, actually, you can show so much creativity in there, because it has to be attractive. It should not be boring, because they should able to concentrate. And another thing, the way you explain to them, they should remember the important things, and it should be interactive. So keep involving, keep asking them. You can nowadays, provide it just printed material or online written reference material in the local language. You can forward them. Or session can be one-to-one counseling or group session. But group session, I prefer group session. When there are a lot of people attending, you get more positivity, positive vibes. Then people ask questions, so everybody listens to those questions also. To make communication more effective, you can use different tools. Like they say you can use the flashcards, flip charts, then the breast model, a baby size doll, and then informational videos you can use in between, so different things. So the visual impact is quite effective. So you can use different things. And other options, it is mentioned, the home visits. Of course, in the private practice, if patient can afford, then whoever the lactation counselor, consultant, or whoever is more passionate about breastfeeding in the hospital based practice, they can do that. Home visits, telephone support, or online counseling. So I have seen, particularly during COVID times, we have done many online classes, but I feel the direct classes are much better. So there is more communication that way. So few points to consider. So monthly delivery rate is the key factor in planning, means how many patient mothers should attend the class at a time. And at least one or two relatives should be there with the pregnant woman. And then you can think, where will you conduct the class? Is the venue big enough? Is there some, speaker and, audio visual to show the screen? And then you can actually invite even lactating mothers that time. So that benefit is that those mothers also will get some more information. Plus, they will breastfeed the baby, while session is going on, and that motivates the pregnant mother more. They watch, they observe, because they're very anxious. The baby is not there, so they don't know what to do. They are just getting the knowledge. But when they see the breastfeeding mother, then actually they get more confidence. Now there was a one Facebook evaluation that how many mothers have breastfeeding mothers has seen anybody breastfeeding, even in the childhood or even on television. And surprisingly, more than 50% of the mothers, they haven't seen anybody breastfeeding. So if we don't see the breastfeeding, if we don't see something, how we expect to do that ourselves, isn't it? So when you get lactating mothers, that is again more benefit. And to share the experiences, appropriately breastfed and complementary feeding becomes an inspiration and role models. Yeah. And attendance should be noted in the antenatal class. So when she goes to the gynecologist and she sees that she's 28 weeks, 30 weeks, and she still hasn't attended the breastfeeding class, then she can give her reminder, listen, next time this date is the breastfeeding class, and please go and attend it. So that attendance recording is important. So what things do we now discuss during the antenatal class? So very important, the recommendations. So I hope you all remember there are 4 recommendations. Then the importance of the breastfeeding. So I'm just going to give somebody 1 minute, somebody who has not spoken so far, and you can just tell me benefits to the baby. What are the benefits to the baby about the breastfeeding? In a simple language, how you are going to talk to mother, not in a scientific or difficult language.
It is the first vaccine the baby receives after birth.
Very good. So what do you mean by first vaccine? You have to explain to her. She may not understand.
It contains the factors which can help the baby fight many diseases.
So baby will be protected from these infectious diseases.
Yes.
Yeah. Yeah. Because this baby will get immunity from the mother.
Yeah.
Baby doesn't produce her own immunity in the beginning. See, simple sentences.
Okay.
Anything else?
Baby catered optimal nutrition.
Yes.
Optimal nutrition in optimal percentage, baby will get exactly what it needs to grow at that stage of life.
Correct.
And it is sterile naturally, so no need to worry about infections.
Very good.
And it is the most comfortable way for the mother and the baby to feed. Natural
Yes.
and comfortable.
Yes.
Also
And
promotes the brain growth of the optimum brain growth of
Yes,
development.
very important. We should not forget this, because these babies' IQs are higher. So these babies get more clever. They have a better performance in the school and colleges. So which mother or which parents they don't want their baby to be clever? Henna. So this is a motivating factor. So better brain development and higher IQ. Anything else?
Mother and baby bonding.
Immunity.
Bonding.
Bonding, that is also very important benefit, the bonding. Yes.
And it's
Some
free,
local
it's
prevention.
available as
Sorry?
required. It's free and it's available as required. There is no extra cost to it.
Yes, it is a free, but sometimes when things are free, we don't have a value for that, And to my opinion, it is not free. How much the mother has to do sacrifice how much her time is gone, isn't it? We have to count all this. Any other benefit?
Prevention of diabetes, obesity later on in life for a baby. The way
Yes.
the obesity is increasing. Yeah.
When the breastfeeding, baby is benefited not only when she's getting the breast milk, she will be benefited even later on in the even adult life. So throughout the life, baby is benefited, and she's protected from even those metabolic diseases. Anything else?
The ma'am, the local gut immunity, because of which the gut problems are lesser in
Yeah, immunity is
breastfeeding.
done. Anything else?
Easily digestible.
Yes.
Even if the baby is preterm or something, mother makes the milk according to her baby's.
Specifically for that baby, that milk is made, isn't it? So you can see there are so many benefits. Even certain childhood malignancies, babies protected from those. Still there are more, but these are the mainly the immunity, the growth, the brain growth, all those things you have to mention, and bonding. And what are the benefits to the mother? Because mother will think I am doing now so much efforts, putting the efforts. What I am going to get from that? Are there
It
any
helps in the
benefits?
recovery. It helps in the recovery of the mother.
Recovery. What do you mean by recovery?
Prevents postpartum hemorrhage, supports contraction of the uterus after delivery,
Yes.
and also bonding, and less chances of postpartum depression has been found in some cases when they are better bonded with the baby with breastfeeding. And
It helps in the weight reduction.
One
It helps
person.
in getting cancer risk, breast cancer, ovarian,
That is
cervical
another
cancer.
benefit. The mother gets protection from the cancer. Risk is less of getting the cancer.
Contraception.
Lactational amenorrhea.
Amenorrhea.
Also, it helps to lose the weight.
Right.
Helps
mother in returning normal weight.
So you have to know even her bones become stronger. She gets some protection from osteoporosis. These are the things that, plus then it is beneficial to the family, to the environment. We need to know the environment also, how it is protected, and to our nation. All those things. You may give some examples, or you may ask mother. Even when you are talking about recommendation, ask mother, what do you think? How long should one give the breastfeeding? And you will be surprised that many mothers, they don't know how long to give the breastfeed. Some even say just 6 months, some may say 1 year. So when we discuss, then they interactive sessions, they will remember better. Okay. So then the birthing practices during the second, now the Dr. Bhagat is going to give the lecture, so I'm not going to talk on that. Then initiation of the breastfeeding, skin to skin contact after birth. You remember the first recommendation, as soon as the baby is born, within few minutes, there has to be skin to skin contact between mother and the baby, so that the breastfeeding is initiated within
1 hour.
1 hour.
Within 1 hour.
Even after cesarean section. And very important thing is early feeding cues, how to recognize the baby is hungry. Then they say, oh, my baby sleeps very often. So how to wake up the sleepy baby. Then the position and attachment, so important. Checking adequacy. How do I know that my baby is getting enough milk? Because when baby is breastfeeding, कुछ दिखता नहीं ना, बॉटल में तो दिखता है कि baby has taken 30 ml, 60 ml. इधर तो कुछ नहीं दिखता. So how she will know? Another thing, babies, they can ask again and again. So they think because my milk is not enough, baby is asking again and again. So you should able to answer those questions. Okay. So if you don't find the answers, or if you yourself have difficulty, you can always ask us. We can discuss again and again. And this of the formula. Many people, recently we went for a BFHI in Pune, one hospital. And we were actually talking to giving training to the hands-on skills to the health professionals. And I asked, what is formula? And not a single person in that crowd knowing what the formula is. And when we are giving so much formula to the baby, not knowing what the formula is. So I think we have to, just tell a little bit about that as well. Going to the work, because more than 80% of the women, they go to the work. So they should not think going to the work means stopping of the breastfeeding. So we have to talk about that. The challenges can happen. What are the special circumstances? And of course, no conflict of interest. So I mean, I think you will need 2 hours. I haven't added one is about the complementary feeding also. We should talk some part of it. Hmm? Okay. So if you say in the class, am I correct? Okay. So does it make a difference if you say breastfeeding babies may have a less illness, or you will say the babies who are not breastfed may have more illness? How will be your language? Which sentence you will prefer?
First
The
statement,
first
ma'am.
one.
First one.
First one.
First one.
What the breastfed babies may have less illness.
First one.
First
Positive,
one.
positive reinforcement.
Yeah, but then you will think that illness is a normal in the babies. है ना? So, and breastfeeding is supposed to be natural. So why we are saying breastfeeding may have a less illness? But if you say कि babies who are not breastfed may have more illness, that second is okay, because there is a not, you think it is negatively. But if you should bring out the discussion that the first phrase implies that illness is normal and the breastfed babies have a less illness in the normal found babies which are not breastfed. The second phrase implies the breastfeeding is the norm and not breastfeeding has the risk. How would you reply to the colleague who says, you make mothers feel bad? That if you tell them that there are dangers if they don't breastfeed, because there may be some mother who will say, I don't want to breastfeed. And you are telling so many benefits and you are taking the class. So you will make the mother feel bad. You think so? So that is also not true. You should give her the factual information. We should not hesitate to tell women that there is we normally don't hesitate that don't smoking is hazardous during the pregnancy, isn't it? So like that we should say also that formula or not breastfeeding also has the risk. We should not hold any information. Very important. Practical demonstration of the breastfeeding technique, position, attachment, expression of the milk. These are all important, using the doll and the breast model, how to manage the common breastfeeding problems, and mainly in the postnatal period, the cracked nipple, the engorgement or perceived low milk supply, and address or concerns or any queries, from the pregnant women or the family members, that, they may have a question that small breast may not produce enough milk. So in special situations, even that some baby may have some congenital abnormality. So maybe particularly to that mother, you can discuss the issues. So you can also tell that there can be so many challenges, so many obstacles. I got a fever, my baby is small, premature, my baby is refusing. But you should tell her that she can cross all those barriers, provided she gets proper support. Because many mothers and the families still don't know that lactation is a specialty and there are lactation consultants in the society, who will help them. You can also tell about the child care that you must have discussed during the hands-on skill. If anybody wants, we can discuss in the future again, because that is also very, very important. Then additional points that take enough sunlight for the vitamin D, vitamin A in the diet is important. So we say you have a carrot, every day. Then see what is the workload she has in the family, who is the help, and when is she going to start working, all those things. You should tell her the normal infant behavior, particularly, how the frequency of the breastfeeding, how to recognize the early cues, and what should be the urine pattern, the stool pattern. She needs to know all this. Take the breastfeeding history. If this is her second or third baby, what is her previous experience, and there will be some mothers who will be high risk of lactation failure. So if you have a time, or when you have a one-to-one class, or you can suggest that if you have any of this history, you come to me later on and we can discuss. Because just one common breastfeeding class, it may not be possible to discuss everything. So we have to reassure that most women breastfeeding, it should not be a problem. And and also the other body parts such as ears, nose, fingers, feet, they may have a various shapes and sizes. Similarly, breast also different sizes and shapes in each mother. So we are not worried about the size or shape of the breast in the antenatal period. Yeah, if she asks to examine, then we can ask. But any antenatal preparation during pregnancy is not needed. There is a lot of myths about the antenatal toughening of the nipples or pulling out of the nipples. So that will make mother more aware that there is some problem with her, and then she will lose the confidence. And also, wearing the bra, she may have the questions, the creams. So we should able to answer all those questions. So breast examination during pregnancy can be helpful, but we should not tell her that her nipples are flat or they are inverted, okay? And automatically the breast changes during the postpartum period, during the labor. So we don't have to really worry during the antenatal. And it sometimes, can be harmful if we tell her that her nipples are a little bit abnormal, or something else. So ideal antenatal preparation is to use the time to discuss the knowledge, belief, and feelings about the breastfeeding, and to build the woman's confidence in her ability to exclusively breastfeed. So normal breast examination during pregnancy is not recommended. Okay, so that is important. Helping in attaching the baby to the breast in early postnatal days is likely to be more effective than antenatal interventions. So we should not use any breast shells or Hoffman's exercises during pregnancy. And the breast examination is done only if mother has some doubts. Okay. So we can give her some sources that where will the lactation consultant available. She can download the Shishu Poshan app. She can also take the child care book we have from BPNI Maharashtra. She can even see our website also. So these are the things about the antenatal classes. Now I'm also supposed to talk a little bit about the maternal nutrition. So what are the key messages? Unless extremely malnourished, virtually all mothers produce adequate amount of breast milk. When breastfeeding mother is undernourished, it makes mother to supplement her diet, then start the baby on the breast substitute. So even if the baby mother is bit underweight, still she produces the milk. Even during the wars and all, they have seen that the babies were fed on the breastfeeding, they grew better. Maternal micronutrient deficiency can affect the quality of the milk. So that can be avoided by improving the mother's diet and supplementing those micronutrients. And the delay of first birth and adequate spacing of the 3 years between the children ensures that maternal stores are restored, for the next pregnancy and the lactation. So the cultural practices restrict women's diet during pregnancy and lactation, which is contrary to that. Appetite generally increases in pregnancy and lactation in response to additional demands. Actually, if you see, the diet, different families have a different cultures. This I have seen in one family they don't give potatoes and brinjal. Just the example. In one family they give everyday potatoes. It is like that. Or only that methi ki sabji and that jawar roti, kuskurun, mesh like. And no tikha wala, less salt. Now, if the mother is not happy about the diet and if she's not getting the micronutrients, how she's going to breastfeed successfully? So we have to explain that to the family that she can literally eat everything in moderation. That is the good chance that she will get all micronutrients, everything, the carbs, the proteins, whatever she needed, and she will be happy. So the family and her, everybody should be eating the same diet. उसको खाली वो वरण and the jawar roti and घर का सब, all tasty food they will be eating. That is not on. Maternal food supplementation all of malnourished lactating mothers does not increase the production to some extent. And reduction of malarial and hukma infection in endemic areas in pregnant women reduce the anemia. So treating that also is important. So if you see the malnutrition, there are some complications of pregnancy, of maternal death, even the neonatal death, anemia. Baby also has a lot of this IUGR, cretinism, birth defects, even hypertension. So, they both have problems. So the body mass index. So ideally it is 19.8 to 26. So those mothers will gain the weight about 11.5 to 16. So underweight, BMI less than 19.8, they will increase a bit more than 12.5 kg. But the obese woman, more than 26 kg, they will gain little less weight, 7 to 11.5. Now, I'm not going to tell details about the dosage and all because, mother, when she's having the diet, she's not going to calculate, what things have what. It is not practical. Instead, you should say, you can eat all the sabjis, lot of salads, the proteins. You can tell her what things the protein has. So that way it will help. And she should have at least, 5 to 6 times she should eat the food. Breakfast, lunch, dinner, and in between 2 or 3 times snacking. She should eat the fruits. And of course, taking iron is very, very important. So treatment of anemia, she has to take more iron. So otherwise, normally in pregnancy and postnatal women, we give 60 milligrams. Even vitamin A deficiency is quite common. So we just give one shot of 200,000 international unit, after the birth. So these are roughly the calories, but I don't want to go in detail because you will just listen from here and you will forget from there. So this is the things that she will need: more calories, more proteins, vitamin A, iron, folic acid, calcium, zinc, iodine. So you look into which food has, sources of this. So how important it is that she eats the green leafy vegetables, how important it is, B12 kisme hota hai, particularly for vegetarian people. So that you need to look. Another thing is milk production requires 500 to 800 calories. She has to burn that much calories extra. And then she will need more protein during lactation, 25 grams per day. So she should have adequate hydration, at least 3 liters of water per day. And of course, the rest, moderate exercise and relaxation. And it is very important that milk production is dependent on mainly on the diet, because that is the myth that, the diet. So क्या खाना है so दूध ज़्यादा आएगा. So I think not much related to the diet. It is mainly she's relaxed and breast stimulation frequently, adequate stimulation, the suckling. If suckling is not happening, then expressing the milk. That is more important. Maternal hydration is also important. So she, as I said, she burns 500 to 800 calories extra. But out of that, 150 calories actually she will able to burn from her body fat. And 500 to 600 she will take from the extra food. So it will help to her to lose the weight as well. So after 6 months, she will need less calories. That is what it. And they lose generally 0.5 kg per week, provided they are not eating those laddus and ghees. So you have to tell them the diet that they don't need to eat too much these sweet things. There are a lot of myths, as I said earlier, कि ये खाना है, ये खाना नहीं है, ये फलाना अच्छा नहीं है. So you particularly get the mother-in-law also and explain to them how important it is that her diet is, everything in moderation. Now, mother herself may not like few things. I had one mother recently. He used to eat lot of Maggies. Even for breakfast, she preferred the Maggie. So I think the counseling of such women is important. The fruits are available, all food is available, but because of her like she's not eating. So, important the counseling. So let us now get the MCQs. So who will read? One by one, somebody who has not spoken, please they come forward.
Ma'am, sorry to interrupt. There was one question respect to the colostrum harvesting in antenatal. And the second question by Pooja only, the role of galactogogues like Shatavari and galactor granules.
Yeah, very important. Now this antenatal harvesting, the midwives, Western midwives particularly, they speak a lot about it. I mean, because she's still pregnant, and then we are expressing the milk, the colostrum, it will come little bit. But to me, my view is that, you make mother more anxious that there may be difficulty after the delivery. But yes, if she's producing the colostrum, if there is a high risk like diabetes or something where she will be less risk of late lactogenesis 2, delayed lactogenesis 2, then certainly we can give her the information, and if she agrees, we can then just teach her the expression, and she can store that colostrum for the baby. And what is the second question?
About the galactogogues like Shatavari and
Shatavari, that
Galacta.
is another thing. We take the Shatavari. Everybody during pregnancy takes the Shatavari. It is, yes, it is scientifically, it is proven that it may increase the blood supply. And yeah, it is a Ayurvedic product. It doesn't seem to have any side effects. So, but I don't think in pregnancy she needs to take Shatavari. But postnatally, if she's taking, let her take. There is no risk at least to her. So that's okay. And in fact, the women who come to us with some not enough production, we do give them the Shatavari. Nowadays, even the pharmaceutical products containing Shatavari are available, so it is easy. They just take the tablet. So we will read the MCQ.